Okay, so we're going to get rid of a little unwanted fat. This is your main concern, and we're talking about doing your flanks at a later time. We're using Lipodissolve, which is something called phosphatidylcholine deoxycholate bile salt that destroys fat cells permanently. Takes about 6 to 8 weeks to see the result. It gets a little red and swollen afterwards, a little bit of discomfort. And the swelling goes down about 2 or 3 days, and the results are permanent, presuming you don't have a substantial weight gain. So we're concerned about this area here, and this area here. And then later on we'll come back and do your flanks. And then measure with my little calipers here to see how much volume of medication I need. So I'm going to use 60 there. I think we already figured this would be like 30 on either side. 30, 30. So you lay down up here. And this is something that's virtually painless, but not quite painless. You're going to feel a little needle pick. Grab my you put your hands up over your head. A little pick of anesthetic. This is a long, I gave her a little anesthetic, I feel it, and I use a long cannula that's sharp that slides right through the tissues, allows me to put the medicine in very fast. And with really no, are you having any discomfort at all?
No.
You really feel nothing. And the phosphatidylcholine deoxycholate gets the fast work on breaking down fat cells. Really works within hours, but the results take a few weeks to be seen because your body's natural clearing processes clears up the fat, just like it might clear up a bruise. So I put 30 cc's in this lower right area. There's a little anesthetic in the solution, so it makes it not hurt. So you can do it quickly and painlessly.
Have you started yet?
Oh yeah, we started almost done.
Yeah. Wow.
I know, it seems like it should hurt, especially when you see the results. Typically we see about 20% of fat cells die after a single session, and most people do it typically 2 times up to 4 times over a period of a few months. And we'll switch sides. Two little skin wheels for anesthesia. There's a tiny needle numb me up, and a little bigger needle to put the medication in. It's not going to go much faster than a bunch of pokes. In the old days, we used to do a bunch of little pokes with needles. It was unpleasant. There's a lot less medication. Now we do higher volumes of medications, way less pokes, way more comfortable, much better results. So people will typically have redness and swelling for about 2 days to 4 days. And the final results we see 6 to 8 weeks. There's no restrictions afterwards. You can do whatever you normally do. This is pretty targeted based on where I put it at. It'll work exactly there. Doesn't go more than an inch further. So we really plan on treating isolated fat pockets or big fat pockets. And this is about as much area as we can do in a day. There's an amount of medication that's known to be really safe. It's about 100 to 150 cc's, and that's about this size of an area.
Someone asked, how much does it cost, please?
Something like this would cost $1,200. Smaller areas would cost less. Like a neck is a very common area we do, that's $600. And this is like a maximum treatment we do one day, that's $1,200. And you'll see about a 25% reduction in the fat after a single treatment. That'll be seen in about 8 weeks. Most people do 1 treatment at least, but sometimes 2 up to 4. And thank you very much.